I love it when I see it, because it's also a sign of improvement. It means the person's getting better, and usually within a day or two, they're totally back to normal and they're back to their life, which is so hard to believe when you see them at first. You would not guess that it can flip. It doesn't always flip, but in this case, when it does flip so quickly, it makes me feel so hopeful. But also, I feel again, I get to meet this person, and I get to see them as they are. And that, to me, the beauty is the humanity, is that true, unvarnished or not obscure, just like the clarity of the sun, right? You see that light, and that is I would say, the most beautiful thing about what I do, and I actually get to see it quite often.
I'm Brandon Vaidyanathan, and this is Beauty at Work, a podcast about how beauty works in our world and shapes the work that we do. Hello everybody, my guest today is Dr. Eloise Ballou. She's a psychiatrist specializing in psychotherapy for adolescents and hospital-based emergency psychiatry. She received her medical degree from the University of Ottawa and completed her psychiatry residency at the University of Toronto. She supervises psychiatry residents at the University of Toronto and also works as a locum psychiatrist in Northern Ontario. Eloise also studied art history and psychology at the University of Toronto prior to starting her medical training, and has a particular interest in applying insights from the humanities to her medical practice. So, Eloise, it's such a pleasure to have you on the podcast. Thanks so much for joining.
Hi, thank you so much for having me.
Listen, tell me about what drew you to psychiatry, particularly with your background in art history. What drew you there?
Yeah, so my parents are actually both doctors, and so I grew up in a family of where medicine was very, ubiquitous and very normalized. But interestingly, unlike most doctor parents, my parents never put any pressure on me to go to medical school or to become a doctor, and they were very supportive of exploring other avenues of, my career. And so that's how I ended up studying art history and psychology. And I had no intention of going to medical school until the very end of my undergrad. It was interesting because when I would meet other pre-med students who were very intense and very focused on, their grades and getting into medicine, I never felt that much of a kinship with that approach. And I think I came to medicine from a very different angle, having always valuing and believing that the humanities and the arts are as important as the science. And again, it's both. They're both equally important, that we need to be scientists and rigorous and logical, but we also have to be creative and open and curious and valuing the unknown as much as the known. And so I think that's how it sort of came to be, to realize that there would be room for me in medicine. And I think psychiatry in lots of ways has been a really perfect fit, because a lot of what we know about the brain it's very limited, right? We have some theoretical understandings, but even things like antidepressants, SSRIs, we don't fully 100% understand why they work, or why they work for certain people and why they don't work for other people. And so to be a good psychiatrist and to work in mental health effectively, I think you have to remain open and accept that you're never going to be in perfect control or perfect understanding about what's going on. And I think that is what's kept me really interested in why I love my job. I think it's always like a surprise. I'm never bored, and I think I'm so lucky to have this kind of work that remains really purely creatively, profoundly stimulating, I'd say.
Was it always like that? I mean, in medical school, did you experience that process of medical training as creative, or did you find creativity there?
Yeah, good question. So I would say no, and I apologize for interrupting, because I do feel that that's such an issue with our medical training, is that and I understand where we're coming from. We want, again, clinicians to be rigorous and to have a certain capacity to memorize a ton of data, but I think we easily forget that we are still we're still explorers, and we're still ultimately people, right? We're people helping people, and I always feel like, if a machine could do my job as well as I could, then a machine probably should do it. Like, we should probably not have people do this work. And the reality, though, is that for the vast majority of medicine, we need humans, right? You want to see a doctor who's a person, who's going to look you in the eye, who's going to engage with you as a person. And I think medical curricula are moving more towards that kind of training. But I think that it's a big source of burnout and mental health issues even within the medical training program, because we are we often forget that we're training people as well, right? They're not just machines or automatons.
I mean, so did you feel like that when you were going through med school? I mean, contrast your experience of doing art history with being in med school. What was that like for you?
Yeah, I mean, I went to a medical school that was bilingual. So Ottawa U has a French stream and an English stream. And so uh, I was in the French stream, which was a little bit smaller, which was quite nice. And it was actually very supportive. So I would say, as far as med schools go, it was a good, it was a good vibe. People were supportive. But I would say that I felt like I lost that creative and artistic focus for sure for those years, just memorizing all the stuff you have to memorize. They say the fire hose of information. That's how they describe medical training. So I would say, yeah, it was definitely a challenge, and I feel like the further I've moved into, after my residency, working as a physician, the happier I've been actually doing the work. And I feel so grateful that I love the work. I did not love the training, but I love the work that I do.
Okay, okay, that's great. That's really great. I mean, do you have a memory that comes to mind of when you knew you were on the right path, or this was the field for you, that psychiatry was really what you should be doing?
I thought about this question, and it's I going into medical school, and even before applying to residency, I had a guess. I'd studied psychology. I had a guess that probably psychiatry would be the right fit. But looking back on my life, very early on, when I was, I guess, 5 years old, 5 or 6 years old, before starting kindergarten. So one of my earliest memories, I had to see a psychologist to start kindergarten a year early. So my parents wanted me to be right the year after my older brother, and so I was assessed by this psychologist. And the experience of I don't remember what the person looks like. I remember the feeling of being observed and seen so closely, and not like in a like a scientist looking under a microscope. It was being in a room with someone whose job was to watch me carefully and try to understand how I think and how I engage with the world. And I realized that they did that as intensely as I do that with other people. And I was like, wow, looking back again, it felt like a recognition that this was a way of being in the world with other people, of being so, again, curious and engaged and connected, and to want them to understand me and for me to understand them. And so I think that has really echoed all through my training and certainly in my work. And that's the feeling I hope to give to my patients, for them to feel held and seen, and that our presence is this bubble of connection that we can create out of nothing.
Wow. Would you, I mean, would you say that, I mean, that experience, that sort of formative experience for you of being seen in that particular way is central to what you're trying to communicate then to your patients? And I mean, is it then that your hope is that they too would continue to, as they leave your practice, would look at others in the same way? Is there any sort of desire for that generativity there?
Absolutely. And I've never actually thought of it that way. But, I train residents and medical students as well. And I try to teach them that as well. But I would agree actually with my patients too. And, the analogy that I've been playing with is like, when you're wearing glasses and they're smudged, right? And you have smudges on them. And so you can't see the world. And I think a very good therapist or a good psychiatrist helps to kind of clean those smudges. It helps, again, through that relationship, to allow you to see yourself and see the world more as it is, and not, the smudges are sort of like our assumptions, our fears, our anxieties that obscure our vision. And I think that as an example, I think of I like doing this work with young adults, and I think about a young adult who came in, a young woman, maybe 14 years old, and her father came into the emergency room, and she was feeling very angry and anxious, but anger was the main emotion. And her father was feeling very overwhelmed and didn't know how to cope. And so they came in together. And I always sort of see the young person on their own, and then I'll bring in the family member if the patient is okay with it. And that experience was allowing me to understand this young woman and why is she feeling so angry, and she's feeling misunderstood, and she's saying things, and her dad is just not getting it. He's not understanding what she's saying. So there's that smudging again. And the dad, the same thing. He's trying to communicate back to her. It's not getting through. And by seeing them individually and then together, I can sort of try on both of their glasses, if you will, and then my own glasses, of course, come into it, which are for sure not perfect, but in that mix, we kind of get some clarity. And I help to point out where those smudges are blocking the communication, right? And in this moment in particular, it was very short. I don't know, maybe spent an hour total in a awful emergency room with like noise and like the not a therapeutic environment, but we were all there, we were present. Everyone wanted to be understood and to figure out what was happening. And it worked, right? Basically through this conversation, the daughter and the father, I could see the bridge being built between them. And my work at its best is an ability to create this bridge between them and to your point, allow them to then hopefully recognize what are these smudges, what are these biases or these assumptions, these incorrect thoughts that they're having or inaccurate, and then apply that to their other relationships. And in this particular case, the father made a very touching comment. He said he was very, of course, thankful for this interaction. And there was a one time, I never saw them again. It was in the emergency room. That's again the magic of what I do is it's this little pocket of time, and they're off they go, and back into their lives. But he thanked me, and he said these like a golden egg, like laying a golden egg. And I didn't quite understand. I thought that's why it stayed with me, I guess. But I guess what he meant was that the generativity again, offering a new way of interacting with his daughter that he loves so much and wants to help, and offering him a path, the beginning of a path forward. So that, that kind of thing, I feel so grateful that I get to do that kind of work to help and to have a small, but I hope significant impact in someone's life.
Wow. Thank you. Let's talk about beauty this probably resonates with things you've already said, but maybe even before we actually talk about beauty, for those who don't really know what a psychiatrist does, could you just walk us through what is your work exactly? What is it? Because you wear different hats, because you're an educator and then you're also a therapist. And could you tell us about those, like what your work looks like in the day to day, and then we'll talk about what beauty looks like in those contexts.
Yeah, for sure. So I'm unusual, I would say, because I do a little bit of everything. So I do a very acute care. So people who are coming into the hospital, they are suicidal or psychotic or deeply depressed or bipolar with a manic episode. So people who have very prominent mental health symptoms and they're in crisis. And so I will see them and assess them and determine whether they're safe to go home to have some outpatient services, or if they have to come into hospital, sometimes against their will. So again, it can be quite intense in that way, and then provide care for them in the hospital over the course of their stay. So that's like one piece of what I do. Another piece is psychotherapy. And so I do this kind of talk therapy work with young adults or people of all ages. I've trained for all ages, and then I supervise residents as well who do this kind of work. And so it's kind of a meta, a therapist for the therapist, if you will, and helping to teach and guide them in that process. So that's another component. And I do a little bit of outpatient work as well. So prescribing medications, and doing, I always do a little bit of that kind of supportive work. I put those into categories, but if I see a patient and they look sad, I'm not just going to say, let's up your antidepressant, right? I'm going to go try to understand what else is going on in their life. And so it's again, to that left brain, right brain sort of science and art. You can't just follow an algorithm to do this well. You really have to be intuitive and understand the scientific underpinnings of what's going on, but also try to dig in to what else might be playing a role.
Would you say your training as an artist or an art historian has influenced then your practice of psychiatry?
Yeah, absolutely. And actually, one of my own interests and what I did some teaching in as well is faces. And so I am fascinated by portraiture and faces. And a big part of what I do as a psychiatry is very closely watch my patient's face. And I have to also be aware of my own face because, for example, a patient who's very manic, very irritable and touchy, they will call me out if my face looks a little bit annoyed or a bit surprised, and they will either kindly or not so kindly tease me about that, and it can be very problematic as well. So I have to be aware of my own face, and I have to be aware of very subtle cues and subtle shifts in the face of my patient. And so an interest that I've had is using portraits, photos, or paintings to teach medical students and residents to pay closer attention to what are these cues and what are you seeing in a face. And when you're looking at a face, how much of that is actually in that face versus how much are you bringing with your own, again, your biases or your own, how you're feeling that day or your background or all these things, how much of that is laying on to what you're seeing in that face. And I think that this is where the arts and narrative medicine, which is this whole area of using the arts for to improve medical care, I think it's a really powerful tool.
Wow, thank you. That's really, yeah. I mean, I think that's it's really vital. Tell me about. I want to ask you a couple of questions about beauty, and again, I think you've touched on this a little bit in your previous example of the father and the daughter. But what is an example of beauty that you encounter in your work? And maybe if there's another story that comes to mind that you would consider this is what makes this work beautiful.
Sure. So it's it's interesting because we think of beauty in maybe more simplistic terms, right? Symmetry or aesthetics or a beautiful sunset. And granted, those things are absolutely beautiful. But when I think to my patient work and what I find really striking in its beauty, I would say it's often in my work in the emergency room. And so an example would be I often get patients who come in who have psychosis, often related to substance use. So they use things like methamphetamines or cocaine or really hard drugs that make them lose touch with reality, and they can become very aggressive, very paranoid, or very fearful. And so they when I see them again for the first time, they present in this very striking way, in a way sometimes I'm afraid for my safety or they are afraid of me, let's say if they're very paranoid. And again, back to the smudging, it's very clouded. Like I don't get a sense of who they are. I don't feel like I know them as a person. But because it's a safety concern, we admit them to hospital. We keep them. Often they'll agree to take some medications, or the substances just wear off naturally. And then within a day or two, it's like the clouds clear, and I get to see who this person really is. And suddenly it's like I am meeting them for the first time. And I often tell them this, and I say, oh, I know we've met a couple times now, but I feel like I'm really meeting you for the first time today. And they agree, and they feel that suddenly we are two people who are, again, together in this space, as opposed to before I'm there, but I can't get a grasp of this other person. They're obscured by this mental illness. And in this case, luckily, a more temporary experience of that losing touch with reality. So to me, I love it when I see it, because it's also a sign of improvement. It means the person's getting better, and usually within a day or two, they're totally back to normal and they're back to their life, which is so hard to believe when you see them at first. You would not guess that it can flip. It doesn't always flip, but in this case, when it does flip so quickly, it makes me feel so hopeful. But also, I feel again, I get to meet this person, and I get to see them as they are. And that, to me, the beauty is the humanity, is that true, unvarnished or not obscured, just like the clarity of the sun, right? You see that light, and that is I would say, the most beautiful thing about what I do. And I actually get to see it quite often, especially in these cases where it feels, again, you would feel easily I don't know, disappointed or scared in those moments, but you have to find that humanity where you can, and that's where I see it.
Wow. So would you say it's the beauty is in discovering their hidden humanity or something like that? Or what is hidden that's being revealed?
Yeah, I would say it's just who they are. I would say that when people have severe mental illness, they tend to be pretty homogenous, meaning they're not you can't really tell the distinguishing characteristics that make them who they are. It's sort of like a stick figure, it's a sketch of a person. And that unfortunately is one of the symptoms of mental illness, is that even just the expressions are often more muted or just more stereotypical. Like if someone's very afraid, they're just going to look afraid all the time, and that's you don't see that peeking out of the personhood. And so to me, the beauty is just in the person. And I think of children, for example, and there's an idea which I agree with, that all children actually uh, are beautiful, are striking in their beauty, and in that energy, and that being in their presence. And why would that be? And I think part of it is because kids don't put on this act, right? They don't put on this polite show for how, and they're not trying to read you for how they're supposed to say, or what they're supposed to say, how they're supposed to act. They just kind of are. And to me, the most beautiful thing about people is when they just are however they are. And sometimes that means they might be angry, right? Or they might be sad, and people apologize when they cry or when they get angry. And to me, I'm grateful that they are showing me exactly how they're feeling, and they're trusting me with their truest self. And that is the beauty for me.
Wow, wow. Yeah, I can relate to my mom. My mom's been living with schizophrenia for some 35, 36 years, and she was unmedicated for a number of years, and so there are very rare moments where she's functional for about 4 or 5 hours a day, and there are these occasional moments when we see the person behind the appearance, or I guess there are times where she asks questions that are like, oh wow, that's an original, that's her, like coming right through, and those are incredibly beautiful moments, and yeah.
Yeah, and you catch them, right? It's hard because I can imagine it's hard to notice and pay attention to those moments when many more moments are not like that.
Yeah, 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 exactly. Yeah. There is a theme that we've been exploring with scientists along these lines, just in terms of understanding beauty as that hidden order or inner logic or something like that that's being revealed, right? So you get an insight into this is how things are. So beyond the beauty of pretty things, or patterns and symmetries and so on that you'd mentioned. Um, and it's really fascinating to see that connection, even in psychiatry, just like in physics or biology. You do see this kind of insight into um, kind of the workings of reality, but in this case, your what is being revealed to you, as it were, is a person, not just an atom or the mechanism, but the humanity of a person. It seems, no.
Yeah, absolutely. And I think you wrote about the idea around Thomas Aquinas and his theories around beauty, where he mentions clarity, and that again, the clarity of the person and the coherence of the parts of who they are and how they fit, and the balance and symmetry of the unique way. It's like a snowflake, right? Like they are unique and yet universal. And that again, it's all these paradoxes. And so I agree with you that it's why would that hold together, even when we talk about a person? But it does, and you recognize it when you see it, and you recognize the absence of that when people are unwell. And when I see a patient and I'm wondering, do they, again, how concerned should I be? Do they need treatment? I try to seek out, am I seeing that clarity and that coherence and that balance in that person? Or is it confused? Is it muddied? And if it's muddied, that makes me worried. And that justifies in my mind, well, we have to keep looking. We have to do more treatment, because they're not there yet. That crystallization, that clarity is not there yet. And then when it's there, I recognize that, the patient recognizes it, and that's how we know we're on the right track. So it's almost like a cue. Not that it's ever taught this way, to be clear, but that's why I think the beauty, this idea of looking at it as beauty, as almost a therapeutic marker and indicator, I think is extremely valuable.
Wow. So let's talk about obstacles to beauty then. Are there challenges to encountering this beauty in your work?
Yes, for sure. The biggest one is probably the nature of healthcare. I mean, I work in Canada, but I think it's the same everywhere. That there are pressures around time and money and all the things that make it hard to stop and be present. Because I think that noticing beauty requires uh, a mindful kind of state where you're not trying to do something, you're not trying to solve a problem. You have to just pause and be with this person in this space, and you have to have in the back of your mind, of course, there's a goal, right? You're not going to sit there endlessly with no outcome in mind, but you have to hold that goal very lightly and be present and just kind of see what emerges. And I think again, the challenge is that everything conspires against that. Everything aligns to make us rush and focus on checklists and focus on the highest acuity risk. And if that's not met, then move on and let them languish to who knows what other mental health services they might have, which is often none, right? So I would say that I can get into that mind space where I want to, I know there's 10 other people waiting to see me. And so more time here means less time for them, or they're going to wait longer. And how do I balance the idea of being present while being efficient, while providing the care, even in the interaction, that it should be therapeutic to sit with me and be with me, even if I don't prescribe any medications, if nothing is different at the outcome, just being with me, I would hope, would have some positive effect. And I think when I'm at my, in my best state of mind and in the right situation, I think that can happen. And so that's what I have to keep coming back to is to slow down and remember that there can be an impact in just being with the person, with my humanity and their humanity in that moment.
And so talk about then what it might look like to I don't want to say infuse beauty into the healthcare field, but it maybe even in your training your residents or even in hospitals or I guess or even for scientists more generally, like what do you think it would take, or what would it look like to cultivate the conditions for this beauty to emerge, or this attentiveness to beauty to emerge?
I think the biggest thing is to actually talk about it openly. And before I came across your work, I had never really thought about beauty in my work, especially as a psychiatrist, especially as you do the work with the scientists. So I think that there's this bias of like beauty or brains, right? Either you focus on the aesthetics and then you're an artist, or you focus on logical science and then you're, rational scientist or a physician. And so I think that saying and being very overt about it, it's not a dirty word to say that looking for beauty in your work is necessary. And I actually think, to the point about burnout with physicians in particular, the stressors I was mentioning earlier, the time pressure and feeling that I'm sort of unable to make everyone happy and inevitably gonna have to cut corners that I wish I didn't have to. I think that by valuing in myself that I need moments of beauty in my work to continue to do this work, right? And to teach that to my trainees as well, that if you are in an environment, either in your personal life or in your professional life, that you can't see that beauty and you can't stop and make space for it, then something has to change. And whether that means you getting your own, taking some time off, getting therapy. I mean, I myself have been in therapy for many years, and I think I think for most physicians and most people, if they're open to it, I think it would help them. So to work on your own inner life, but then to tell clinicians and scientists that yes, beauty is important. You're not wrong. You don't have to hide it. You don't have to feel sheepish about it. Like, this is as important as the science that you do, is recognizing that you need beauty and you need meaning, and that they are not mutually exclusive.
Right. I mean, does it help to, I mean, thinking about what medical training looks like, then, like, do you need something else from the humanities or from the arts, some other form of education that needs to be part of medical training then for this to happen? Or?
Yeah, I think medical schools are, I mean, certainly even since I've graduated, have included a lot more of this narrative medicine or focus on mental health of their trainees and of their staff. And so I think that there's a movement towards that. But again, there's always more knowledge to be learned. There's always new medications coming out, and it's unfortunately the first thing to go is the subjective, right? We think objective is valuable. If you can measure it, if you can rank it, then we know what's good or bad. But things like beauty, like meaning, you can't put on a Likert scale, right? You can't put an objective metric to it. And so it's easy to say, well, that must mean it's not important, right? If I can't measure it, like when we say what gets measured gets done, right? So we can't measure beauty or meaning. And so we tend to forget about it. So if anything, I think we have to be extra diligent about paying attention. It's just like mindfulness. How often do you take 5 minutes to be mindful during the day? Most days I don't. I know it would make me happier. And when I've had, periods in my life where I was more consistent about it, it had a positive impact. But it's the first thing that's going to get pushed out of the way with all our to-dos in our calendar. And so I think it's a mindset, and I hope that we can shift more towards the idea of the experience and the subjective as being equally valid to the objective.
Well, we are, my study is trying to put beauty on Likert scales and try to measure it. So,
I'd be curious to see how you do that.
Yeah, I don't know how successful we are, but at least in terms of how frequently scientists experience it, or in the different types of beauty and so on. But it's not very deep, right? I mean, it tells you something, and then you have to really talk to a lot of people for a long time to understand what those things mean.
Well, and I would say it's a good point, because maybe the better way to frame it is that we don't know yet how to measure these things, right? And the same way we don't know how thoughts appear in the brain. It is just neurons firing, right? Ultimately, it is an objective structure, but we use analogies and we use sort of these shorthand ways to frame it. And unfortunately, as much as I say this, I think the world will always value what is measurable. And so maybe the way to start by measuring it, to say that it's important and to find ways around it, gives it sort of at least a ranking or a place within all these other measured things. And then maybe we can look at the subjective aspects of what we think is also purely objective, right? That we talk about pain, rate your pain on a scale of 1 to 10. That's a Likert scale. But we also, as physicians, we say, is the pain sharp? Is it dull? Is it electrical? Does it throbbing? People will use they'll say it's like a chill, or it's like a burning. And those are more subjective terms, but they're equally important. And if I'm asking about someone's pain, I want to know more than just 1 out of 10, right? It's gonna help me far more. And so I am curious to see, if we talk about beauty, what would be some objective ways to look at it that can complement the more subjective.
No, that would be great. And I think, as I have these conversations, as we've had even conversations with scientists, if we could go back and redo our survey, we might try to rethink some of these questions. But it's challenging because you have to give people a set of forced categories, and then they have to rank things, and finding the right categories is always immensely challenging with an issue like this. But there is, I think there's something there to making it, as we talk about beauty mattering, it would probably be important to figure out, well, how do we know if we're doing it well, right? What are the indicators
Absolutely.
of success there? And so we'd have to figure out some way there. And I don't think we're there yet. So tell me about when you're, we've talked about your experience of beauty, but what about for your clients, for your patients? Are you trying to get them to be attentive to beauty? And does beauty matter for their mental health? How does that work, that part of it?
Yeah, it's interesting. Again, I've never really talked about it overtly, but since talking to you and reading and writing, thinking more about these things, I would say that there is absolute value in having them think about beauty, and in the way that I mentioned, paying attention, right? Paying attention to how they're feeling, paying attention to others, the other people around them. I would say, someone who's depressed, one of the symptoms of depression is anhedonia, which is lack of pleasure, inability to feel pleasure. So inability to experience beauty would be one of those. And someone who's an artist or a musician who says, I don't get any pleasure anymore from these things that I used to enjoy, that's a signal, right? That's important to pay attention. They're not, bad or wrong for not feeling it. It's that there's something. It's again something in them is out of balance and has to be corrected. So I think that's definitely has a role, and I think that also I've had moments. For example, another anecdote is I had a patient I saw as a resident actually who was bipolar, who was in a manic state at a hospital here in Toronto that has this beautiful. The unit is on the top floor and overlooks Lake Ontario, so it's spectacular. It looks like the ocean. And so he would wake up every morning and watch the sunrise over the lake. And he told me about this, and I was really struck by it because I had never noticed that there was this incredible view right outside my window, and that even though he was ill, he was not in a good state of mind, he was seeing something that I was missing. And I think there's a lot of research around the gifts of mental illness, if you will, of the perspective that it can bring. And this patient, as he got better, as his mania resolved, he was not watching the sunrise anymore from the window, right? He was back to his life and got to pay the rent, and what am I going to do for a living, and conflict with his girlfriend, and all that stuff came back. And so it's not as simple as health equals beauty, right? I think that sometimes there are insights that can come from seeing things differently, and I was grateful to have had that experience, because now I pay attention, right, on that unit. I notice it. I'm never gonna not see it again, or I hope I won't. And that was really, really special. And I had, it was a bit bittersweet to see that shift as his mental health improved.
Wow, wow, wow. Well, leave us with one piece of advice, perhaps, for those of us who are scientists or professionals, academics, other listeners who are perhaps trying to figure out, well, what does it mean for me to encounter beauty in my work, or what can I do to be more attentive to it, or prevent it from misleading me? I mean, are there any tips you could suggest?
Sure. I mean, I think that one of the ideas that I come back to a lot is the idea of the dialectics. This is a term we use in psychiatry that means holding two opposing ideas at the same time. And I think I've, talked a bit about this today, that you can be logical and emotional, right? You can be rational and impulsive. Like you can be, and you can love someone and hate them at the very same time. And so I think that to become more comfortable within yourself, that you can have opposing ideas, that you don't have to choose and stick to one, right? So the idea is not to have no emotions or to always have emotions. It's to have them come and pass through you, and like a wave, it sort of goes through, and then you're back, you're back to some equilibrium. And I think thinking about beauty in that same way, that it's not about there's one either way to look beautiful or to notice beauty, or that it's a goal in itself. It's really an experience, and the experience is going to be a constant dynamic equilibrium based on your life and what's happening in the world, and to be patient with yourself and patient with the world if you can be, and to just accept it with that equanimity, which is another sort of great mindfulness concept, but that it doesn't have to be one or the other, and to sort of be curious and open, and to just see what happens. And I think that it's a challenging point of view, because everything pushes us in the direction of pin down an answer and decide and check the box and decide what you're, who you are and what you're going to be and what's important to you. But instead to keep it open-ended, and to trust that even if you remain open and curious, you will still find some solid ground, that both are going to exist, and that it's not dangerous to let go, that you will be able to find grounding as well.
Wow. Thank you. Eloise, thanks so much. This has been really fantastic. Any other thoughts before we close? Anything else that you want to add? Anything that came to mind? Anything I missed that you want to share?
Well, thank you so much. No, this is, as I said, this has been so thought-provoking, and I feel like in mental health in particular, I think there is so much room for this idea of thinking about beauty, and sort of taking the word back, if you will. I think there's a lot of challenges around the word itself and the assumptions around that word. And I would be very excited and curious to see where this goes in terms of helping people's mental health, because we are in a time where this is universally needed. And I think that this is an avenue that we haven't really explored yet. And I'm very grateful for the work that you're doing, because I think that it has the potential to really help. And ultimately, that's what that's why I'm here, is to help people. And I think that this is a really powerful and novel way to help. And so I'm really grateful with what you're researching, what you're doing.
Wonderful. Thank you so much.
Thank you.
Great. Hey everyone, thanks for watching. If you liked that video, please hit that thumbs up button and share it with your friends. Also, please take a second to hit the subscribe button, because it really helps us out. Thanks.